Hello and welcome, pharmacy students. Today we're tackling a super important topic, one that's crucial for your exams and, more importantly, for your future practice. We're talking about therapeutic incompatibilities. You know, what happens when you have all the right drugs, but they end up having the completely wrong effect. Let's get into it. All right, so here's our game plan. We'll start by setting the scene with a common pharmacist dilemma. Then, we'll nail down exactly what this problem is. After that, we'll break down the 5 main reasons it happens, look at some real-world examples you'll definitely see again, and wrap it all up with a quick recap of the key points for your exams. So first up, let's talk about the challenge that pretty much every pharmacist faces. It's this tricky situation where a prescription looks fine on paper, but in reality, it's just wrong. I mean, really think about that question. It's the absolute core of what we're talking about today. It's a scenario where a prescription can go south, fast, even if all the ingredients seem perfectly correct. And yeah, that's a pretty scary thought. Okay, so the big umbrella term for this is a pharmaceutical incompatibility. Basically, it's anytime you mix stuff and get something you really didn't want, something that could be unsafe or even just look wrong. But today, we're zeroing in on the one that's most clinically significant. So let's get a really clear definition. What exactly is a therapeutic incompatibility? Getting this right is so important, not just to pass a test, but for your day-to-day work as a pharmacist. And here it is. The key thing to remember is that this is all about what the drug does in the body. It's a pharmacological issue. We're not talking about a simple physical change like something crashing out of solution in a bottle. We're talking about the drug's actual effect being different from what the doctor intended. Right, so we know what it is, but now for the really interesting part. Why does it happen? If you can understand the why, you're already halfway to preventing the problem. This framework is vital. And here they are, the 5 main culprits. We've got overdose, using an improper or wrong dosage form, prescribing contraindicated drugs, issues with synergistic and antagonistic drugs, and finally, drug interactions. These are the main pathways that lead to trouble, and we're going to zoom in on the most common ones with some solid examples. Okay, this is where the theory meets the real world. Let's look at some practical examples. And you'll want to pay close attention here, because these are classic scenarios that love to show up on exams. Let's begin with arguably the most serious and direct type, an overdose. A lot of the time, this happens because of a simple, tiny error when writing the prescription, and it's your job, as the pharmacist, to be that final, crucial safety check. Just look at this. It's a perfect example. The prescription was written for 0.5 grams of codeine phosphate. Well, that's 500 milligrams. But what the doctor actually meant to write was just 5 milligrams. That's 100 times the intended dose because of a misplaced decimal. That's a potentially fatal error. All right, next up, contraindicated drugs. This is all about knowing when a drug is a definite no-go for a specific patient, maybe because of a health condition they have or a known allergy. Your role here is to be a bit of a detective and protect your patient. Here are a few great examples. Corticosteroids for a patient with a peptic ulcer? Bad idea. Penicillin for someone with that allergy? Absolutely not. You can see how the patient's specific situation is everything. It's not just about knowing what drug to give, but also when not to give it. Okay, let's shift gears to a really, really common cause, drug interactions. This is a huge area. It happens when one drug's effect gets changed by another drug, or sometimes by something as simple as the food a person is eating. Now, within drug interactions, you've got 2 main forces at play. On one hand, you have synergism. That's where 2 drugs work together to create an even stronger effect. Sometimes that's done on purpose. On the other hand, you have antagonism, where one drug basically cancels out or opposes the effect of another. So, let's look at a classic textbook interaction. This is one that every single patient taking this antibiotic needs to be warned about. So here's the play-by-play. A patient takes their tetracycline antibiotic with a glass of milk. The calcium in the milk immediately grabs onto the drug, binding with it. This creates a complex that the body can't absorb. So what happens? The drug passes right through the system without doing anything. It has no effect. This is a perfect illustration of why patient counseling is so incredibly important. Okay, we've gone through a lot. So let's boil it all down to the absolute must-know points for your university exams. So, to wrap it all up, here's what you need to have locked in. First, be ready to define therapeutic incompatibility, remembering that it's a pharmacological issue. Then, be able to list those 5 main causes and, this is key, give a clear example for each one, just like the ones we talked about. If you've got that down, you are in great shape. And that's our look at therapeutic incompatibilities. At the end of the day, remembering all this isn't just about passing an exam. It's about building the skills and the vigilance that will make you a great pharmacist, the person who spots the error, who asks the right questions, and who turns a potential problem into a safe and positive outcome for your patient.